Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, student. How are you today? Okay, I'm glad to hear about you. You are fine. Okay, yes. I can see you again for this afternoon, okay, with English 5 subject. Today's topic is about assessing the patient for meeting. Okay, first, before I start, I would like to remind you, don't forget, you have to fill in the option. Okay, you have to fill the attendance list. Okay, yes, and then don't forget you have to download the Materi from the Google Classroom, okay, the handout, and also there is a link in YouTube, okay. So how about this lecture, okay? Alright, student, assessing the patient with vomiting. Alright, vomiting and nausea. Yes, nausea and vomiting, this is combined together, okay, because nausea is a unpleasant sensation of sickness that someone want to vomit. Okay, so before vomiting, someone suffering from nausea first, and then vomiting is the forceful ejection of stomach content via the mouth. Okay, and I think all of you have experienced how to take care of the patient with vomiting because you did the clinical placement in the last semester and you went to hospital to do the clinical placement. Okay, alright, student, how about nursing assessment in vomiting? You are understanding, okay, the nausea and vomiting. So in managing that case, nursing assessment is very important to you. The correct nursing assessment, you will identify the cause and you can treat the symptom more accurately. So the first keyword is the nursing assessment. Okay, assessment the treatment effectiveness, and you can monitor a pathway toward the relief. Okay, so in the nursing assessment, you have to identify what is the cause of vomiting. How you have to ask the patient about that. Okay, all right, and then you have to provide the treatment. So appropriate treatment for nausea and vomiting should be directed toward the underlying cause. Okay, so the cause is underlying in here. Okay, and then simple measurement should be short first before you commence the medical treatment. Okay, for example, if your patient has dehydration, okay, we call acute dehydration, and some of them may suffer from shock, for example, should be corrected with intravenous fluid. Okay, so you have to give intravenous fluid. Okay, and then let's have a look here. Okay, what is the trigger? Okay, the cause with the vomiting. Okay, the chemoreceptor trigger is, we have three shown in here. Okay, the vomiting triggered by the drug, for example, or chemical or toxin. So you have to give the patient treatment by antihistamine, for example, and then anticholinergic. This is with the medication. You can have dopamine antagonist with the cannabidiol, for example. Moreover, if the vomiting triggered by the surgery or chemotherapy, because the patient has cancer, for example, and the patient suffer from food poisoning. Okay, poisoning. So the treatment should provided is, okay, neurokinin receptor antagonist. Okay. In addition, if you look at the vomiting triggered by fear, anticipation, pain, octaphory, for example, okay, so the treatment that you have to provide, that is benzodiazepine. Okay, alright, children. Alright, this is the concept about the vomiting. Now, I give you the reading passage about the vomiting. Okay, we have reading passage here, short reading passage. Okay, about the vomiting, you have to read. Okay, the first is when a patient is sick and content of stomach are ejected through the mouth, for example. Okay, and you have to read. Okay, this material you can download first, and then you can print out, it's okay, or you can save in your mobile phone, and then you can open and you read and learn. Okay, to understand. When you have reading patient, you don't understand, okay, what kind of word in that sentence. Don't worry about that. Okay, yes, don't worry, take it easy. Okay, better you have to open your dictionary. Okay, I advise better you use manual dictionary to look at what kind of word that you don't understand. Okay, in that reading. Okay, in the second paragraph, you have when vomiting is a symptom that consists of vomitus and the frequency of vomiting are noted. This is about the nursing assessment. Okay, yes, you can read the whole of this sentence. Okay, until you understand, you got the idea about the second paragraph. Okay, when you finish, okay, read and get the new vocab, and then you look at the dictionary to understand about the meaning of the new vocab, okay, by the manual dictionary. Okay, so you do this exercise. Okay, what is the best topic, and then you have to say again the reading passage using your own word. Okay, because you already know the keyword in the paragraph. Okay, alright. And then in the exercise 2, you have to answer the question here based on that reading passage. Okay, alright. Would you please to find out the answer, okay, from the reading? We have 8 questions. Okay, student? Yes. You read, and then you have find out the difficult word, for example, and then you have new vocab, and then you get the meaning. Okay, and then you have to understanding it and try to get the answer from. Okay, alright, children, move to the speaking section. Okay, in the speaking section, there is a conversation between nurse and the patient. This is Mrs. W. Okay, you have to fill in the gap. Okay, for example, how are blah 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 today, Mrs. White. Okay, you have to get the answer. Okay. Okay, what is the answer? How are feeling today, Mrs. White? Okay, feeling today. Okay, alright. And then, what is number 2? Mrs. White, I feeling better now, but something I get sick, for example. Okay, alright. The rest you can do by yourself. In here, I have second speaking practice. is the same way. Fill in the blank. Okay, fill in the gap. There is a word of provide, stop, look, come, see, have, give, and feel. Okay, for example, patient, nurse, I feel very sick. Okay, good. And then, can you give me something for? Okay, and then, have you been vomiting? Okay, would you please to do this speaking practice? Okay, get the answer from the word provided. Okay, alright. Okay, student, now we move to the structure of grammar problem. Today's topic is about problem with redundancy. Redundancy. What is redundancy? Redundancy is unnecessary praise. Okay, redundancy means you say more than necessary. Okay, in all pattern or prefer simple direct sentence to complicated or indirect sentence. Okay, so redundancy, this is again and again, this is unuseful. Okay, unnecessary word. Okay, alright, let's have a look here. Antonio Conte learn English for nurses quickly. Okay, yes, Antonio Conte, subject, verb, learn, complement, okay, English for nurses, modifier, quickly. Okay, so you have to understanding this redundancy. For example, here is exercise number 1. The nurse know a great deal in terms of the condition of the situation of asthma. What do you think about this? Number 1. This is true or false? False. Okay, good. Why? Because the word, the condition, and the situation is the same meaning. So this is redundancy. Okay. So what should the correct sentence? The nurse know a great deal in terms of the condition of asthma, or in terms of asthma. That's it. Okay. Yes. And then number 2, the disease was very serious in the nature of it. What should the correct answer? The disease was very serious of it. Okay. Yes, without in the nature. Alright. This is about multiple choice question. Okay. Courteous and manner is the same. Courteous and manner the same. Okay. So you have to look at the redundancy in here. Okay. Alright. And number 2 and number 3, you have to identify, okay, about the phrase or word that is incorrect. Surgical nurse work in medical ward, show rapid away. What should the answer? The answer is E. Okay, this is incorrect. So the correct answer, the correct sentence: surgical nurse work in medical ward, show rapid. Okay, without way. Okay, redundancy or repetition. Okay, redundancy is the same meaning with repetition. You say again the word with the same meaning. Okay, so you have to avoid, because this is unnecessary. The money that I have sufficient enough for the patient need. The money that I have sufficient for the patient need. Sufficient and enough is the same meaning. So you have to delete one between them. You can use have enough for the patient or I have sufficient for the patient enough. Okay, you can choose one between them. Okay, student, here is the same. Okay, for example, this is about the redundancy and repetition of word with the same meaning. For example, the nursing class advanced forward rapidly. So forward and rapidly is the same meaning. So the nursing class advanced forward. or you can choose the listening class at front repeatedly. The same. Okay? Alright. Okay, children, the next you can do it by yourself. Okay. Here is the exercise you can do by yourself. Okay. Don't forget. For example, here the idea of restraint for mentally ill is an old ancient one in psychiatric hospital. Old and ancient is the same meaning, so you have choose one between them. Okay, alright. Okay, student, I think that's all. Now you have independent learning activity at home. Okay, you can do in your leisure time. Okay, you have to spend 170 minutes doing independent learning activity. Don't forget, you have to work with your friends. Okay, you can work with partner. Okay, write the dialogue about assessing the patient with vomiting. Okay, how do you say as you are assessing patient who is vomiting? Okay, and then go through the procedure with partner and make notes of what you need to say. I give you some advice here. This is maybe possible sentence that you can use in dialogue. Okay, for example, if blah 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 blah, please let me know, sir or ma'am. If you feel nausea, please let me know. Okay, atau please tell me about your chief complaint, for example. If you have any problem, please tell me about that. If you have stomachache, please call us immediately. Okay, this is some sentence, okay, that you can use in the dialogue. This is my advice. Okay, children, I think that's all our teaching for this afternoon. Okay, thank you for listening. Okay, don't forget you have to do independent learning activity. You have to spend 170 minutes to do the independent learning activity. Okay, keep study hard, stay at home. Okay, keep healthy, and let's close our studying by saying Alhamdulillah together. Alhamdulillahirabbil alamin. Thank you for watching and listening. Don't forget like and subscribe. Okay, student, thank you very much for your time. See you next week. Have a nice day for you. Wabillahi taufiq hidayah. Wassalamualaikum warahmatullahi wabarakatuh.